80% of women of African descent will have uterine fibroid in their lifetime. And compared with the general population, Black women are 3 to 9 times more likely to suffer from uterine fibroids. We also tend to develop fibroids at a younger age and experience more severe symptoms. Today, we'll be examining some factors responsible for this disparity. My name is Omolola Odigwe. I'm a medical doctor and I am passionate about helping people achieve their health goals through their diet and lifestyle. Fibroids are non-cancerous growths in the uterus, and the uterus is that organ in the female where an unborn baby develops and grows. So to the factors that are responsible for this disparity. The first is vitamin D deficiency. Women with normal levels of vitamin D have a 32% lower risk of developing uterine fibroid. Vitamin D is a fat-soluble vitamin that helps the body use calcium, magnesium, and phosphate, and also plays a huge role in the reproductive system. It is one nutrient that the body can produce by itself, and it does this by using ultraviolet light to convert cholesterol in the skin to vitamin D. However, in the Black population that have more melanin, melanin absorbs ultraviolet rays, reducing the production of vitamin D in the skin. It's been shown that vitamin D inhibits the growth of uterine fibroids. In fact, a 2016 study conducted by Siavatani et al. Examined 108 women who received vitamin D supplementation and who had small body uterine fibroids. Participants had less than 4 fibroids each, and each fibroid measured less than 5 centimeters in diameter. This study found that women who did not take vitamin D supplements experienced an average fibroid volume growth of 40% in 1 year of follow-up, whereas women that regularly took vitamin D supplements experienced no fibroid growth during the same time frame. Another factor responsible for this disparity is the use of chemical relaxers in Black women. These relaxers contain harmful chemicals that, when absorbed into the body, act as hormone disruptors, predisposing to development of uterine fibroid and even uterine cancer and endometrial cancers. Most times, these chemicals get into the body through broken skin or bones sustained during the application of these relaxers. So these are 2 major factors that have been identified as the reason for the disparity. Other factors that can predispose a woman to having fibroid, irrespective of her race, include any condition that persistently increases estrogen. Okay, so estrogen acts as a growth factor for fibroids, and we see that fibroids express more estrogen receptors than even the normal uterus. During pregnancy, uterine fibroids tend to grow bigger, and in menopause, it shrinks. Okay, women that are overweight or obese are 2 times more likely to develop uterine fibroid than women with healthy weight. Also, women with polycystic ovarian syndrome are 65% more likely to develop uterine fibroid. Chronic hypertension, type 2 diabetes, and some other conditions associated with insulin resistance have also been shown to increase the risk of developing uterine fibroid. So in summary, any condition that persistently raises blood estrogen, vitamin D deficiency, chemical compounds in hair relaxers, insulin resistance play a huge role in the development and growth of uterine fibroids. Also, please note, early age at first menstrual period and late onset of menopause are also risk factors to developing fibroids. Now, to the role of diet in prevention of uterine fibroids and also in reducing the rate of growth. A low-carb diet can help manage uterine fibroid symptoms and potentially slow their growth, because we found that adapting a low-carb diet improves insulin resistance, helps maintain a healthy weight, helps with weight loss, and even improves the symptoms of polycystic ovarian syndrome. There is a growing evidence that oral vitamin D supplementation can help stop fibroid growth and may even shrink fibroids for women with vitamin D deficiency. Avoiding foods that are high in phytoestrogens like soy and flaxseed can also help. Also, avoiding alcohol, which can disrupt hormonal balance and contribute to fibroid growth, is key. And interestingly, taking green tea regularly has been shown reduce the growth of uterine fibroids. One thing I'd like for you to take away from this session today is that our diet is very vital in the prevention of uterine fibroids. And also, if you already have uterine fibroids, make sure to see your gynecologist. You both will be able to reach a treatment plan that is suitable for you. Do not care for uterine fibroids by yourself, even when it is not symptomatic. Always carry your physician along when you make lifestyle changes and when you make dietary changes with the hope of reducing or shrinking a fibroid. Medical investigations can be done to monitor the effect of your lifestyle change on the fibroids. If you already have symptomatic uterine fibroids, make sure to see your gynecologist. When I say symptomatic, I mean having symptoms like heavy menstrual bleeds, bleeding in between periods, pain during sexual intercourse, frequent urination, constipation, and the likes. Make sure to see your gynecologist. You both will agree on a treatment plan that is best suited for you. Thank you so much for listening. I'd like to know your thoughts in the comments. Also, make sure to like this video and subscribe to this channel. Thank you so much.